Okay, we're back again, part 3, and we're just continuing to draw up medication. Sorry I'm having to break the videos up, but it's very difficult to upload large video files sometimes. And just to let you know, the medication that I take is a byproduct or a filtered product of human plasma donations. So hey, thank you all for donating plasma.
Absolutely.
Yes. And normally, like say, when you teach someone to self-infuse, if there's an occasion where they need to or something, you basically just do the same procedure just as you're doing it right now, but they would just, they wouldn't have to take any extra precautions other than what they're doing right now, right? For
Correct.
a peripheral, gotcha. For a port, you would just have to make sure you sterilize the far out of the area, right?
Correct.
Because being central line.
And then it has to be, of course, the skin has to be sterilized before you
Yes.
access the port.
And they usually come with an iodine sterilization as well as a viral sterilization, everything. There's a whole kinds of stuff, chloropreps, everything.
Mm-hmm.
Gotcha. You know, what's really funny is when you do this kind of stuff and you're a patient long enough, you almost become like your own advocate and almost like a doctor because you get used to that particular thing and finding out all the variations of it.
And it's always good to stay well educated on what you're getting and
Sure.
how the process works.
Definitely. Let me ask you a question. Like, just say for instance, a lot of people have actually talked to us. They've said that if someone is like, like if there's a traumatic event or something that happens and you have a patient that's about to, losing a lot of blood, of course, you call the EMTs and you get the ambulance on the way, but sometimes it takes a little while for them to actually get there depending on how bad the traffic is, especially here where we live. Of course, if someone had to intervene to try to help, first thing you would do is you would try to stop the, the bleeding, of course. You would try to use something a tourniquet or something. But if it's something that's really bad, theoretically speaking, if a person had something like this, I don't even know if they could even, like say if they had like if the person had blood or something like that and they wanted to transfuse it, but you would have to make sure they're the same type. You have to make sure of all kinds of things. But a lot of people who encounter those things, I've had paramedics ask me, it's like, I wish I could actually, kind of understand exactly how to do this and everything. From what you understand, paramedics are able to do this, right? They're trained to do this, or is this actually a level above that, normally speaking?
Most paramedics are trained to give emergency line medications.
Yes.
In the hospital, like out in the field setting on the way to the hospital.
Gotcha.
They usually have a set of standing orders kind of based upon what's going on with the patient that they work off of. Now, as far as transfusing a medicine like this, I'm not aware of paramedics being able to do that.
Right. But, realistically, like say if if a normal person or anyone, even paramedic or anybody that's already, that actually has been trained on basic self-infusing and stuff, it's pretty much anybody can learn this as long as they have someone to teach them correctly.
Correct.
Okay.
Correct.
Gotcha.
Yes, it's something that we teach people to do in the home often.
Sure.
I think I might have misunderstood your question.
Sorry. I was I kind of got really kind of around the block on it, trying to formulate it and everything. But basically, anyone who's in a home who has a medical need that basically needs to administer an IV like this, there's no reason a person should be concerned with that if they're trained to do so and they've got their correct supplies and stuff. There's nothing that says, hey, this has to be a doctor to do this, right? Or this has to be, a nurse if you're trained correctly and stuff.
Right, if they're trained by a nurse and checked off and there's documentation of that through the nurse's company,
Yep.
then yes, that individual in the home is able to mix the drug and infuse it.
Right, gotcha. Thank you, I appreciate you clarifying that. Sorry, I kind of went around the world on that question.
That's okay.
Right, so now we're still going on the vials. Don't have.
This
it's going
is
pretty
our
quick.
last one.
Oh, is that the last one?
Mhm.
All right, thank you.
These large gauge needles really help out getting it in the bag quickly.
Definitely. Wow, look at all that medication going in there. It's filling up quickly.
Mm-hmm. Okay,
Is that it on that
that's
part?
it.
Okay, now we're gonna hook up to the line.
And that's what it looks like.
Sorry, let me make sure I don't move.
And then this piece in the middle is the piece we twist off
Okay,
to access with.
let me see. You just basically pull that
You
off.
just
okay?
pull it, you twist it,
Uh-huh.
and it comes right off.
Okay, wonderful. Gotcha.
Then we've got our tubing.
Oh, I see. That's what it makes. I got you. It makes a place for the spot to punch. Gotcha.
Exactly. We have our tubing here.
Alrighty.
We want to clamp that initially. You just push in,
Gotcha.
always open your vent.
And that just keeps it from basically running all the way.
You don't want it to run out in the floor.
Gotcha.
Right.
So it's a big stopper.
You
Okay.
take your spike,
Okay.
push and twist.
And just push and twist until it's inserted into the bag.
And then when you hang up here, you want to fill your drip chamber about 1/2 to 3/4 of the way full.
Gotcha.
Then we'll hang it on the IV pump.
Okay. Or pole if you don't have a pump.
Yes, IV pole, I'm sorry.
Alright. There we go.
And then we're going to open our dial all the way to open.
Uh-huh.
Then we're going to unclamp our white clamp
Okay.
to let it
Now just
prime the
let some
tubing.
medication run through. Gotcha.
It's coming up to the end here. You can see it.
Yep, sure can. I can see it
We'll
moving.
let those air bubbles drip out. And we're done.
And that's it.
That's it. So now I'm going to get alcohol and clean it off and hook up to the patient.
Okay.
Take this blue cap off.
Sure, sure.
Clean your white cap.
Ultrasonic. Gotcha.
Mm-hmm. Twist that.
Mm-hmm.
And then I'll open the white clamp and we're ready to go.
And we're ready to start.
And to open it, you just pull up on that.
Gotcha. Then you have the little thing where you can set your flow rate.
And we might need to flush you. It might.
Oh, yes.
Sometimes if it's been a little bit since you put that IV in, you need to flush it to get the medication flowing again.
Sure.
Let me cut this off here.
Sure. Turn it on. I clot very easily. So we run another saline to just flush the area. You can see it pushing through. And that's just in case it clots to where you need to reopen up the vein fully.
Okay.
All right, now we get
Open
back up.
back up.
And this time we do that and turn on the pump, or not pump, turn on the on switch. And it's probably because I'm standing up.
Yeah, I think you need to sit down gravity-wise for it to.
Let me see here. Oh, yep, as I sit down, there it goes dripping. We see. All right. Okay, we'll be back as soon as we're done with the infusion part and we'll show the deaccessing. Thank you.